Welcome back to Ask Allison. Here's today's question. I've been wanting to transition my private practice from solo to group where I can have limited permit holders working under me. I'd like to be able to contract with the one insurance panel I panel with to be able to bill insurance for my employees/consultants working under me as well as myself. Can you help me figure out how to do this? Eventually, I'd also like to transition to all self-pay clients, my dream. So before I answer, I would love to thank Therapy Notes for sponsoring Ask Allison. They are the #1 rated electronic health record system available today with live telephone support 7 days a week. It's clear why Therapy Notes is rated 4.9 out of 5 stars on Trustpilot and has a 5-star rating on Google. Therapy Notes makes billing, scheduling, note-taking, and telehealth incredibly easy, and they also offer e-prescribe for you prescribers out there. If you're coming from another EHR, Therapy Notes makes the transition incredibly easy, importing your demographic data free of charge so you can get going right away. Find out what more than 100,000 other mental health professionals already know. Use promo code ABUNDANT at therapynotes.com for 2 free months. All right. So different places, different states call people different things. Limited permit holders, as I know them, are referring to associate licensed, pre-licensed, in some places, interns. These are folks who have finished grad school but have to accrue hours in supervision before they can get their final license. So I'm answering based on that information. Most, but not all insurance companies will cover limited permit holders if the group is credentialed by the insurance company. So you'll need to get a group NPI, also known as a type 2 NPI number. Start the process of getting your group or type 2 NPI and get credentialed as a group, even if it's just you for now. Get in touch with provider relations for the panel you're on to ensure that if you're credentialed as a group, you can bill for the work of limited permit holders. You didn't ask this, but it's often one of those things you don't know. Anyone under supervision needs to be an employee, not an independent contractor, if you are their supervisor. And this is because you cannot regulate how a contractor does their job, and supervision is literally guiding someone through clinical care. Now, you say your dream is to have a private pay practice. So I'd actually encourage you to consider going private pay first. It's scary enough to make the switch from insurance to private pay when you're solo. But to make it when you have people depending on you for their livelihood is a lot more pressure. So if you do it now, you can earn your private pay sea legs, see that the flow of clients is different, be able to market and adjust accordingly before you bring on somebody whose livelihood you're responsible for. You're going to need to hone your marketing to generate enough private pay clients for a group practice. And for help with that, join us in the Abundance Party or in Party Plus. Party Plus, we give you more hands-on help. If your marketing is dialed in, definitely check out the Group Practice Exchanges membership called The Exchange. It's going to teach you everything about owning a group, from the offer letters to leadership training to finances. It's really comprehensive. It doesn't go as deep on marketing and getting clients in the door, but in terms of how to really run a smooth practice that people aren't leaving and saying that was an awful place to work. The Group Practice Exchange will make it where you have a responsible, appropriate, well-run business that is good for everyone involved. All right. I hope that was helpful. Today's free worksheet is linked and includes 5 questions to ask yourself before starting a group practice. If you haven't heard me say it before, it is not the logical next step when you are full. It is an entirely different skill set to be a boss than to be a therapist. And so many people come to me leaving group practices because there was such poor leadership in their group practice. So always get leadership training. If you would like that free worksheet, you can DM me or put a comment, the word sheets, as in worksheets, and we will send you the link for that. And I hope that you are doing well and having a really wonderful day. Take care.